Welcome to the Wellness Dentist Podcast. Join biological and cosmetic dentist Dr. Katie Toe as she explores holistic wellness through trending ideas, real stories, and patient experiences. This podcast will inspire you to make healthy lifestyle choices and take charge of your dental wellness. And now your host, the Wellness Dentist, Dr. Katie Toe.
Welcome to the Wellness Dentist Podcast, Oral Health for Longevity with Dr. Katie Toe. I'm so excited. My best friend and twin is on the show today. You know how hard it is to get her sit down because she's such a busy mom, a busy clinician and entrepreneur, and an amazing cook too. So she's my private chef, aka when we travel together. So this conversation is going to be really fun. It's going to be about her wellness journey, motherhood, her cooking skill, and of course, her amazing expertise in dentistry that you cannot miss. So, Doctor, please welcome Dr. V Ho.
Thank you so much, Dr. Katie. It's such an honor for me to be here today and to chat with you and share with you and our audience.
We talk to each other all the time, but it's never sit down with a microphone. And she's like,
Right.
what? Yes. So, obviously, I know your story, but I don't think people really hear your wellness journey or your wellness story the way you're going to tell our audience. So share with us,
Okay.
how do you get started on this wellness journey? Because I know it's for yourself.
Right. No, absolutely. I think, with any journey and for it to be so prominent, it has to start with our own personal issue, right? Because we are our biggest motivation. And so for me, I had a chronic illness that really handicapped me for 8 years. I had severe insomnia for 8 years where I couldn't sleep. Seriously, I couldn't sleep for 6 nights out of the week. And at that time, I just graduated, went through 3 pregnancies, working 6 days out of the week, not sleeping 6 nights of the week. And you think that I would be sleepy and make up for it the next day, but I just never could. I was always wired. And it left me puzzling because, of course, as you know, I felt like I searched everywhere and everyone to try to find out what was going on. But no one could help me. Everything was one. I even went through 2 psychiatric evaluations just
Wow.
to see if I had postpartum, if I had anything. And my husband made fun of me. He said, "You did that for nothing." I said, "Well, no, at least you know from 2 people that I'm not crazy."
No, you're
So,
not crazy.
and I think that was for 4 or 5 years where I just couldn't. I was wired and a motherhood and working 6 days, and then I think on the 4th or 5th year after that, made up for the total 8, almost 9 years. It added on the severe bloating where I
Mm.
could not. I thought at first that was food allergies. But then, of course, I verified it wasn't anything. So I could just not eat for a whole week and my stomach would be so bloated. Just even a sensitive touch would be so painful. And I just couldn't understand. And I love to eat. So, of course, nothing was ever found. Everybody told me I was fine. I was fine. I said, no, I'm not fine. I'm just
Mhm.
not fine.
Yeah.
And so the last draw for me was I had a skin attack where
Mm.
it looks like I got clawed by a cat on my face and on my neck. And my eyes were swollen, my face was swollen, it was blue underneath. So I prayed to God. I said, find a way to help me because I cannot survive like this anymore. To where I feel like I couldn't even drive because I didn't have the attention span because you can't pay attention when you don't sleep 6 nights of the week.
Mhm.
So anyways, I think I stumbled upon just something totally different, totally new. And I said, you know what? I've tried everything. I just have to do it because I live very healthy. I mean, I thought I'd live very healthy. I mean, the best that I could, but nothing. I felt like it was my fault for some reason. Maybe I didn't do something right. And I think this new finding that I stumbled upon, it was just so new. I didn't know much about it. And to society, it was a normal thing. So I never even suspected it to be any problem. But I said, I'm desperate. I need to do something.
Yeah.
And I found out that it was my breast implants that really almost killed me. So yeah, I learned about breast implant illness. And I decided, I said, you know what, I'm just going to take it out. I'm not putting anything back in. So if it doesn't help, it wouldn't hurt. And I kid you not, immediately my skin healed within a matter of a couple days after the surgery. And ever since, it's been maybe 4 years, I would say. I mean, I eat like a teenager. My metabolism is crazy.
I seen that.
Yeah. So, and I think because of that, it's not like I wasn't aware or appreciate a healthy lifestyle because I grew up with my grandmother and being in the Vietnamese culture, that was always a thing. You're always made to name the benefit of something before you put it in your mouth. So it was a thing, it was like our everyday life. But
Food's medicine.
Yeah, but I never really understand or even make it such a big thing to focus on whole body wellness, and what one thing could seem so harmless could affect other part of your body, and you really have to look beyond what's in front of you. So I think that's where my journey began.
Wow. And a lot of people never thought about it, right? But then when you start looking for the support group, you see so many women actually going through Explant and start seeing their health improving. And so I'm always tell, the audience that like, if your body telling you that you are not well and you are suffering, but all your doctors say you fine, you're gonna have to find different doctors.
Yeah.
Right? Until someone that be like, yes, I seen it. I helping people like this, or I'm going to explore this with you to help to get you better. Because a lot of doctor would say no to the Explant because they're like, oh, there's nothing leaking. Everything looks good.
Yeah.
But you'll find a doctor that could help you. And then you finally solve the mystery.
Honestly, what I learned from that is, for me as a patient is that ultimately you are responsible for your own health. You need to be your number one advocate. But what I also learned for myself as a doctor is, listen, be a better listener, and try to
your patient. Yeah.
Yes, be a better listener, and try to help them look beyond what I do, to help them and not just dismiss them when I just like, oh, I care about what I do. If whatever I do is fine, then whatever else problem they have is none of my problem, or it's not associated. So it made me a better doctor, and also I know how to better care for myself.
Yeah. You can't pour from an empty cup. We know that.
Yeah.
But of course, through this journey, I can tell that you're approaching patient care in a whole body, aspect. For example, Dr. Viho is one of a couple endodontists in the world that doing biological, follow the philosophy and the approach. And when we send patients over for evaluation, right, you want a professional, an expert, and a specialist looking at this patient. Is that a jaw pain? Is that a tooth pain? Is that a sinus infection? I appreciate a provider who understands the whole body connection, because not every tooth pain that will end up with the tooth being worked on or removed. Yes. Or, needing extra treatment. Is also, she was checking the system, asking questions like nutrition, because that's actually your big passions. It's not just food, but how food can nourish the body.
Absolutely.
Yeah. So share with us a bit about your professional daytime job. Because you're helping patients every day. So people want to know, like, what do you do?
Yeah.
As a biological endodontist.
Yes. And I think, I appreciate you asking the first question and sharing with you my journey of wellness. It really made me become more aware of, oh my gosh, what am I putting into my patient's body? And how could something seem so benign could be killing someone, and because that's what happened to me. Like, have you ever heard of anybody having breast implant problems? Usually you don't. Like, it's such a benign thing, everybody go around with it, but no problem. So going through that journey made me even more aware and really respect what my patient has to share with me, and really pause and think about it, and think about what I'm doing that could be helping or hurting my patient. So because of that, I review what I do, what I was taught, and ask myself, well, what can I do to make it better for them? What can I do to lessen the damage for my patient? Because my patient always asks me, is this good, is this bad? I said, honestly, there's nothing ideal. We just have to do the least damage for you, but my job is, at least I owe it to you to what you're getting yourself into, and then I want you to feel that you have made an educated decision and confident about it. So I went on that journey. I changed the way I practice. So from the beginning, I really listened to their whole, like, their story, what they have to share.
Yes.
And not just, oh, I only want to know about your tooth. And
Yeah.
are you in pain? Are you not in pain? Do you need a root canal? You don't need a root canal. I actually really listen to their wellness journey and see how I can support them overall.
Mm-hmm.
And I get into the procedure itself. I share with them, this is what I do. The material that I use, for example, I have really eliminated a lot of materials that really are necessary, because the ultimate goal of root canal is bacterial, and to get rid of the bacteria, right?
Mm-hmm.
So we use ozone, for example.
Mm-hmm.
As we know, that's a very powerful disinfectant.
Super.
And also we use the laser,
Mm-hmm.
which is really the most powerful tool that you can use, because we all know the biggest struggle of root canal is the root canal failures. And a lot of failures are due to not being able to get into the nooks and crannies to clean them. And we're leaving behind a lot of bacteria in the nooks and crannies that could really hurt our patient. So how do we get something that could travel deep down to get into those areas and reduce those bacteria? And the laser does that without leaving any harm. And in fact, it actually does help the patient to heal a whole lot better by improving blood flow, nerve repair, and therefore reducing postoperative pain.
Yeah.
So, and then honestly, for me, the ultimate goal is I want to avoid a root canal for my patient,
Yeah.
because I just look at, what if that was me or my child? What would I do?
Mm-hmm.
And I'd be so happy if my patient doesn't need a root canal.
Mm-hmm.
So if depends on the case, depends on the situation, we always give the patient the option to regenerate the tooth via PRF.
Mm-hmm.
Um,
So their own blood cell.
yes,
Yeah.
using
For
the own stem
audience doesn't
cells.
know what PRF is. It's basically you draw blood, you spin it down,
Yes.
and then you picking the platelet-rich fibrin,
Right.
the part of the cell, the body where it's help with healings and fighting infections,
Yep.
and then you giving the body extra help from
Exactly.
your own cell.
Yep.
Mm-hmm.
You really just need a scaffold stem cell, and your body can regenerate, and you getting right from your own source.
Mm-hmm.
So we don't have to worry about reaction or allergies or anything like that.
Mm-hmm.
And we also use a powerful laser in cases where we can just heal and promote, and the materials that we use to heal and promote, have the area heal and promote, and just have the dentin to grow back to cover the exposed nerve, and therefore potentially could avoid the patient needing a root canal. And we've had quite a few cases with successful cases with that as well. So
Yeah.
to me, that's a small procedure, but for me, that's the biggest win.
Yeah. I love that you stress the fact that you want to keep your teeth.
Yep.
Nobody in here want to remove it or kill it or do anything to it, because ideally we want you to keep it.
Right.
But you're the one that also start talking to patient now that you understand the meridian system.
Right.
You be like, when you have a tooth hurting, like we talk about how the patient have the lower front teeth hurting, it's not the teeth, it's the UTI.
Right.
And so I don't believe in my education, dental education, people teaching or mention anything about meridian system,
Right.
connect with the teeth, but we know is existing, right?
Absolutely.
So the fact that you look at the patients, the whole body, and helping them making the educated decisions and put their body, like, of course, listen to their body and asking the questions with the provider that listening, I think that's the part that people need to understand. That you ultimately make the decision,
Right.
but you have to have the right information to make that decision.
Right.
So share with us a little bit about Meridian, because I know you actually have extra training with Dr. Don Ewing on Meridian. You actually having the chart in your office. You connect the teeth with the organ. And so they now know, okay, it's not just my tooth, but it's also, I'm constipated for years. Also, I having a breast implant on the same meridian, right?
Yep.
Things like that you have experienced every day in your practice.
Yeah. I think having all this knowledge, I think makes it extra fun for me, to be honest with you. Because before, it's just simply, hi, you're here for a root canal. You need a root canal, or you don't need a root canal. And I'm sorry you have other issues. Sorry, I can't help you. I don't know what else to say. But, I think once I've got into this journey, I really enjoy my patient conversation. If it's just a conversation, a whole lot more. Like you said, the meridian chart, we know the teeth are connected to other organs or part of your body. And I've had that done on myself. I had the charts all over my office. And so the patient first, they really feel like I understand and I listen to them, because
yes,
I have it here. I share with them my knowledge. So I think, that's where I get so excited because I really can combine my nutrition background. So for example, like you said, certain tooth is connected to their, let's just say kidney or the liver, for example. I know I get so excited because, oh, I can help you. You love food. I love food. And then I can share with them, hey, to support your kidney, for example, I tell them, hey, I have this recipe for this black sesame paste that you eat for your calcium is way better than milk or way better than any of these things. And you don't have to worry about dairy. And I think that's how I bond with my patient. And I think relationship building is so important. And I know at the very least it benefits me.
Yeah.
It makes me having better relationship with people is just so good for your health.
Yes.
And I feel like I don't just do that for my patient, but I benefit from it as well.
That's why you're so happy.
So yeah, and I feel like, having my background in functional nutrition counseling, and background in biological dentistry training really help tie everything together and make my treatment and my conversation with my patients a whole lot more meaningful because I can share with them so much more than just the topic of dentistry.
Yeah. That's why you're a unicorn, because not only you have all that background blend together, you're
Yeah.
practicing it in your real life. I've seen it.
Yeah.
We're going to biohacking conference together. We
Yeah,
are
we do,
roomies. So
we do.
we're doing
Yeah.
all that for ourselves because
Yeah.
we know we cannot pour from an empty cup. And we
Right.
know that as a mom, our children always count on us to show up.
Yes.
You take a day off being a mom because
No.
I don't know anyone do, right? No matter what, you have to be there for them because
Yeah.
that's what mom do. So
Yeah.
what are you doing at home with all that knowledge that you have? I know everyone curious, like what she's eating, what she's cooking, what she's doing, that consider like wellness practices that non-negotiable. Because I know you do a lot. So we don't have enough time to name everything. So let's just pick 3. This is like I'm asking all my guests on the show, like pick 3 wellness things that consider non-negotiable for you that you're doing every day.
For me,
Mm-hmm.
when I wake up, I made sure that first I train my mind. It's a mindset training that no, I deserve this and no, I should not feel guilty. Is time for me. Me time is morning time, not end of the
Mommy
day.
time. Mommy.
Me time is my time in the
Mhm.
morning
Yes.
before everyone wakes up. So I wake up. I want to enjoy my detox drink that I drink, which is
Yes.
lemon water and salt.
Love it.
And I don't want to rush to drink it.
Yep.
I want to sit and sip it and really breathe it in. So that's what I do.
Mm-hmm.
And then I do weight training.
Yes.
Yes. And then while I do preparing my black sesame peas, soup that I make, I prepare something nutritious for myself in the morning.
Mm-hmm.
So while I do that, I listen to personal growth, such as the app from Brendan Bouchard, the Growth app.
Woohoo! Shout out to our coach.
I learned to put all those things in, and I feel like doing all those things at the same time really like a complete wellness package for me.
Yeah.
We tie
You are
together.
bio-stacking. That's what they call it.
Stacking?
Bio-stacking. No longer biohacking. You're stacking all this habit
Yeah.
helping you. Yes.
Yeah, I get my health right, my mind right. And of course, my children is, being able to feel like I care for my children is very important to me.
Mhm.
So having the time to really, I cook for them every day for lunch.
Yeah.
To properly plan that and cook
Mhm.
that for them.
Mhm.
I think that's for me, that's my morning for
Yeah.
sure.
That's your love
And
language.
then in the evening is sauna.
Ah!
Sauna is a must.
Okay.
And I walk my dog. I get my steps in, and I make sure that when I'm not rushing, I go out there in the sun. I go out there, I lay out in the sun. I walk barefoot in the grass because I feel like I need to connect. I think having the sense of connection deep within yourself and the earth around you is just so important.
Yeah.
And getting your mind straight and getting your mind right
Yeah.
for the day.
And you've been sleeping more than
Oh my gosh.
one night a week?
No. I sleep like a baby. Before I tried all sort of supplements, all sort of detox. I mean, it helped some. And even at times where it helped me for 6 months. And I thought, wow, I found a cure, but it went back. So now I sleep so good.
I remember those times. You're like, I think I found what's happened. And then you're like, oh no, it's not it.
No. Yep. And then, for me, um, doing something fun, getting me excited and motivated on the weekend is also important. I need to make sure I have time for that. And for me, that's pickleball. Because I feel like you have to find something, whatever that thing is for you, where, because we're always so busy.
Yep.
Our mind is running 1,000 miles everywhere, all over the place. We never actually sit. To me, that's my form of meditation, because I just focus on winning the game. And I laugh. And then that's it. I don't think about anything else.
You'll be 100 and super sharp, because that's eye, hand, feet coordinations. And that's Dr. Daniel Amen said that's the best exercise for any of the brain health. So congratulations.
Oh, thank you. I haven't hurt myself yet.
Yes, yes. So I noticed that, a lot of people on the show, no matter they patients or they healthcare provider, they always taking care of themselves first. Just like when you're on the airplane and, they said, put your oxygen mask on before you put the mask on, someone else. And I think that for a lot of healthcare professional, it's such a hard concept, because we always put patients, team, or everyone else that in the family, would be our children, our spouse, our parents, especially. This is the season a lot of our friends are really, we call like in the sandwich between the kid are not out of the house yet, but the parents do need attentions and the care.
Yep.
So if you don't take care of yourself, you will let everyone else down.
Absolutely.
And so it become a responsibility out of a necessity, no longer like, oh, I make time for it. No, you have to do it.
Yeah, right.
And so I love that you share your routine, especially like your morning routine where you said it's me first.
Right.
And I love sauna. So I love that. So I know that, with your background and what you're doing every day helping patients, people are going to have a lot of questions, because the topic of endodontics, aka root canals, are so hot. We actually receiving so many questions from people every week about root canals topic. Is it bad? Is it good? And you just have to follow the professional like Dr. Viho, who understand the whole mouth-body connection and have enough knowledge. And because it had to be case specific.
Right.
Like I do not like to answer questions like just a general, be like, oh yeah, it's bad for everybody. It's good for everybody. None of that is true. Now we know that everything had to be personalized. And so if you have questions about any of that topic, want to know more about, root canals, is that good for you, is not good for you, and what's happening. Yes, all the people's stories are powerful, but you definitely want to know about your body, about your story, about how that's going to work for you, a personalized approach. And so how do people that listen to the show, watching the show, can connect with you?
Instagram. People can find me on my Instagram handle at Dr. Viho.
Mm-hmm. Yeah. So DRVIHO. We put that on the show note. And I know we have to bring her back, because we're going to see how many pickleball championship that she's had, because I know her personality. She's not going to play for fun. She's played to win.
Oh, you have to play to win.
So Dr. Viho, thank you so much. I know you're super busy, and it's always fun to sit down. And honestly, I knew of your story for a long time, but listen to you telling that story about the whole wellness journey is really emotional, because I was there when you were having that surgery.
Yeah.
I remember, and it's not an easy decision. Especially people talk her out of it, guys. People are like, why did you do that? Are you crazy?
Yeah.
But when you know something is not right and you are having no other choices, you've done everything, you try everything.
Yes.
Then when that, you'll be like, you're so confident this is going to help you. And I respect that determinations. And I know that she's finally found the answer.
Yep. I sleep good. Now I'm an expensive day. I eat too much.
Now you have pickleball to how to keep it off. So follow and, reach out to Dr. Viho on Instagram. And of course, subscribe to our show, and we'll see you at the next episode. Thank you for listening today. Wellness starts in your mouth and includes your entire life. When you understand that, the whole game changes. Come learn more at thewellnessdentist.com. We see you in the next episode. And remember, there is always a reason to smile.